Alcoholism is a word many people use to describe a serious problem of drinking. But medically, the condition is generally called alcohol use disorder, or AUD. It is a medical condition involving difficulty controlling alcohol use despite negative consequences. It isn't simply a lack of willpower, and it doesn't mean someone is a bad person. Alcohol changes the brain, and repeated alcohol use can affect the systems involved in reward, stress, decision-making, memory, and impulse control. That can make stopping or cutting back much harder than simply deciding not to drink. One of the biggest misconceptions about alcoholism is that you can always tell who has it. You can't. Someone with alcohol use disorder might drink heavily every day, but another person might drink less frequently while still experiencing serious problems related to alcohol. The amount and frequency of drinking matter, but so do things like loss of control, cravings, consequences, and whether alcohol is interfering with someone's health, relationships, school, work, or daily life. So, what actually happens in the brain? Alcohol affects several neurotransmitter systems. It can increase activity in pathways associated with reward and relaxation, while reducing certain forms of brain activity involved in alertness and anxiety. This can initially make a person feel relaxed, less inhibited, or more sociable. But with repeated exposure, the brain adapts. The same amount of alcohol may eventually produce less of the desired effect, which can contribute to tolerance. Some people then drink more or more often to achieve an effect they previously experienced with less alcohol. This creates an important cycle. Alcohol can temporarily reduce unpleasant feelings, but using it repeatedly as a way to cope can strengthen the connection between uncomfortable emotions and drinking. Eventually, stress, loneliness, boredom, social situations, or even certain places and routines can become triggers for cravings. The brain begins learning. This is what we do when we feel this way. Craving is one of the important features of alcohol use disorder. A craving isn't simply wanting a drink because you enjoy it. It can feel like a powerful urge that occupies your attention and makes it difficult to focus on other things. Environmental cues can also trigger cravings. Seeing alcohol, being around people who drink, visiting familiar places, or experiencing certain emotions can remind the brain of the reward it associates with alcohol. Another important concept is tolerance. Tolerance means that the body becomes adapted to repeated alcohol exposure, so a person may need more alcohol to experience the same effects. But tolerance can be misleading. Someone may feel like they can handle their alcohol because they don't appear as intoxicated as someone else, while their coordination, judgment, and reaction time are still impaired. Tolerance does not make alcohol harmless. Alcohol can affect almost every part of the body. Long-term heavy alcohol use is associated with problems involving the liver, heart, digestive system, immune system, nervous system, and other organs. It can contribute to conditions such as liver disease, cardiovascular problems, pancreatitis, nerve damage, and certain cancers. Alcohol can also interfere with nutrition because heavy drinking can affect appetite, digestion, and the body's ability to absorb or use certain nutrients. The brain is also affected. Heavy or prolonged alcohol use can interfere with memory, attention, coordination, judgment, and emotional regulation. Some people experience significant problems with concentration or memory, and severe long-term alcohol-related brain damage can occur. Importantly, alcohol-related problems can develop even when someone doesn't fit the stereotypical image of an alcoholic. Alcohol also affects sleep. Although drinking may initially make someone feel sleepy, alcohol can disrupt normal sleep architecture and contribute to poorer quality sleep and nighttime awakenings. This can create another cycle. Someone drinks because they're having trouble sleeping. Alcohol disrupts their sleep, and then they may drink again because they feel exhausted. Mental health and alcohol use are also closely connected. Alcohol can temporarily numb difficult emotions, but it can also worsen anxiety, depression, irritability, and mood instability. Some people begin drinking because they're struggling emotionally, while heavy drinking can then make those emotional difficulties worse. This creates a complicated relationship between mental health and alcohol use, and treating only one side may not fully address the problem. Relationships can also be affected. Alcohol use may contribute to arguments, broken promises, financial problems, missed responsibilities, changes in personality, or withdrawing from loved ones. Some people begin hiding how much they're drinking because they're embarrassed or afraid of judgment. Secrecy can then make the problem even more isolating. One of the warning signs of alcohol use disorder is continuing to drink even after recognizing that alcohol is causing problems. Another is repeatedly trying to cut down or stop, but being unable to do so. Other signs can include spending a lot of time obtaining, using, or recovering from alcohol, experiencing strong cravings, failing to meet responsibilities, giving up activities because of drinking, drinking in situations where it creates significant risk, and continuing despite physical or psychological problems that alcohol is worsening. There is also a difference between alcohol misuse and alcohol dependence. Someone can experience harmful consequences from alcohol without having developed physical dependence. Dependence can involve the body adapting to alcohol to the point that stopping suddenly can produce withdrawal symptoms. This is an important distinction because withdrawal can sometimes become medically dangerous. Alcohol withdrawal can involve symptoms such as anxiety, shaking, sweating, nausea, insomnia, agitation, and a rapid heartbeat. In severe cases, withdrawal can involve seizures, severe confusion, hallucinations, or a dangerous condition called delirium tremens. Someone who has been drinking heavily or regularly should not assume that suddenly stopping on their own is always safe. Medical guidance may be necessary. This is one reason alcohol use disorder deserves to be treated as a medical condition rather than a moral failure. Treatment can involve many different approaches depending on the person. Some people benefit from counseling or psychotherapy. Cognitive behavioral therapy can help people identify triggers and develop healthier coping strategies. Other approaches focus on motivation, relationships, trauma, or learning how to manage cravings and high-risk situations. There are also medications that healthcare professionals may prescribe for alcohol use disorder. Depending on the person, medications can help reduce cravings or reduce the rewarding effects of alcohol. A healthcare professional can determine whether medication is appropriate and which option is safest. Support groups can also be valuable. Some people find peer support programs helpful because they provide connection with others who understand what they're experiencing. Recovery doesn't have to look exactly the same for everyone. There isn't one single path that works for every person. And recovery is possible. The brain and body can adapt when alcohol exposure decreases or stops, although the timeline and degree of recovery vary from person to person. Some improvements can happen relatively quickly, while other changes may take much longer. Recovery is not about becoming perfect. It's about gradually building a life in which alcohol no longer controls your decisions. It's also important to understand relapse. A return to drinking doesn't mean someone has failed or that recovery is impossible. Addiction is a chronic condition for many people, and setbacks can happen. A relapse can instead be a signal that something in the treatment plan needs to change. Perhaps additional support, different coping strategies, treatment for an underlying mental health condition, or changes to the person's environment. If you're worried about someone else's drinking, confronting them with shame or insults usually isn't helpful. A calmer approach is to express concern, describe specific behaviors you've noticed, and encourage them to speak with a healthcare professional. You cannot force another person into recovery, but you can let them know that support is available. And if you're questioning your own relationship with alcohol, you don't have to wait until everything falls apart before asking for help. You don't have to prove that your drinking is bad enough. If alcohol is affecting your health, relationships, responsibilities, emotions, or ability to control your drinking, that's enough reason to talk with a healthcare professional. Most importantly, alcohol use disorder does not define someone's character. A person can be intelligent, successful, loving, responsible, and still develop an addiction. Addiction can happen to people from every background. Understanding alcoholism means moving away from the idea that someone simply needs more willpower. It means understanding the brain, the body, behavior, environment, mental health, and the complex reasons people become dependent on a substance. Alcohol can change the brain, but change can happen in the other direction too. With appropriate support, treatment, and time, people can recover, rebuild relationships, improve their health, and create a life that isn't controlled by alcohol. If this topic describes something you're experiencing, reaching out to a doctor, addiction specialist, or other qualified healthcare professional is a strong first step. You don't have to wait until you're at your worst to deserve help.